Well, in this week's Cardiology Countdown, we have an FDA approval of a new pure fish oil, also a large meta-analysis of coronary calcium by age category, and radial access for ST elevation primary PCI. So first up this week is the ANCHOR study, just published online at the American Journal of Cardiology, that looks at one of the new fish oils that the FDA just approved based on other studies for lowering of triglycerides. This particular study looked at moderate elevations of triglycerides between 200 and 500 and found a significant reduction, about 21%, with the 4-gram dose of the AMR 101 agent. And this is a pure EPA fish oil that has a unique feature of not raising LDL, which has been seen in other agents with fish oil. And indeed, in this study, it actually lowered LDL significantly by 9%. Interestingly, also lowered CRP by 22% and Lp(PLA2) by 19%. So an interesting new agent approved currently for treatment of triglycerides above 500, but which is being studied in the REDUCE-IT trial to see whether it also reduces coronary events. Next up is a large study looking at coronary calcium score to predict outcomes stratified by age. This was a study done of 44,000 asymptomatic individuals and stratified patients by coronary calcium score of 0, various gradations up to greater than 400, and then looked in age categories of the very young, less than 45 years of age, and elderly patients above age 75. And across each of the categories, there was a graded relationship. The higher the coronary calcium score, the higher the risk. And so this became a significant predictor even in the very young and in the older patients. And so I think a nice validation in a huge study of the usefulness of coronary calcium. The number one pick is a randomized trial looking at radial versus femoral access for primary PCI in ST elevation MI. This was the RIFLE STE ACS study done at 4 large centers in the Netherlands and Italy, where they compared an overall cardiovascular outcomes and bleeding as the primary endpoint, found reductions in cardiovascular outcomes. Indeed, cardiac mortality was significantly reduced, as well as lower risk of bleeding with radial access. And as such, a randomized trial in 1,000 patients does support the use of radial access as a preferred approach for primary PCI. So for this week's Cardiology Countdown, I'm Chris Cannon.